be all the glory.
Thank you, Reverend Judy. Do we want to turn it over to Dr. Bryant to lead us through our first presentation, please?
Be happy to do so. So once again, want to thank Mr. Lawson. Want to thank you for your extraordinary leadership in this space, for your advocacy, for this opportunity. There's several areas that I want to touch on today. I want to talk about COVID in general, and how it's transmitted and symptoms. Because my specialty is pediatrics, I want to talk about COVID in children, the vaccination, what the symptoms are, how does this appear, what has been our experience with children. Briefly touch on safety practices, and Reverend Wortham did a great job of providing those 4 W's. So encourage you to remember those very, very important words of wisdom. And then an overview of the vaccines that are currently available. As most of you know, there are 3 that are currently available. And then really touch on the last 2 things, which is the impact of COVID-19 in minority communities, and talk about why getting vaccinated is truly important. And I will admit that my bias is about vaccination, and I'll explain to you why that is true. But let's talk about COVID first. So it is a viral infection, and the type of virus it is what we call a coronavirus. And those viruses have actually been around for quite some time, so it's not new. But this is a disease that emerged, and if you've been listening to the news at all, and it's very difficult to escape, then you've heard about the scourge that this has taken on citizens here in the United States and really worldwide. So we are approaching 600,000 deaths and counting. And now we have seen an uptick. So if you recall, last January, LA was at the epicenter of this pandemic. And we were running out of ICU beds, hospital beds. People were actually making decisions about who to care for based upon the likelihood that that individual would or would not survive. And fortunately, the vaccines came on the scene, and we saw a precipitous decline in the number of cases, hence the number of hospitalizations, the number of deaths. Right now, if you look at the United States, I think the most recent statistics suggest about 67% of those eligible to be vaccinated have at least 1 vaccine. Somewhere around 50% of those eligible in the United States have been fully vaccinated. So that brings me to a discussion around the variant. So this Delta variant, variants occur because, frankly, viruses are smart. They like to find a way to survive. And so in those folks who are unvaccinated, that is an arena where the viruses start to change their identity, if you will. And in changing their identity, seek to make themselves stronger so that they are much more resistant to the therapies that we have available. And the Delta variant now has emerged as the primary variant that we are seeing here in the United States. Current statistics suggest that of those currently hospitalized, over 90% of them actually are infected with this variant. So it is the predominant variant that we are seeing among those who are most ill here in the United States. It is far more contagious than the other variants that were previously identified. To put it in perspective, when the virus came on the scene, it was suspected that if you had close contact, you could infect 2 to 3 people. This virus is 2.5 times more contagious. So whereas those people could infect 2 to 3 people, now we're talking about infecting somewhere between 5 to 7 people. So far more contagious than previous variants of coronavirus or COVID-19. So what are the symptoms? The symptoms are highly variable. but classically, they can mimic the symptoms of a common cold. So we're talking about runny nose, cough, sneezing, even allergy symptoms. And that's been something that's fooled people most recently. Say, no, it's just my allergies acting up, only to then test positive for COVID-19. It often presents with headache, sometimes sore throat, body aches, sort of those flu-like symptoms. And then we've seen very unusual ways that it can present. But for the purposes of this discussion, it can present very much like common flus, common colds, even your seasonal allergies. So please be aware of that. And testing is available. I encourage you, if you develop those symptoms, because of just how contagious this virus is, that you actually get tested. So what are the symptoms in children? And we've had experience here at Children's Hospital of Los Angeles taking care of children, unfortunately, who have been infected with COVID-19. They're very similar. We see the runny nose, we see the sneezing and the coughing. In general, the symptoms prior to the Delta variant have been less severe in children. So they have not gone on to develop the breathing problems that many adults have that require that they be on breathing machines called ventilators, that the experience with children has been less severe prior to Delta coming on the scene than it had been for adults. With Delta, we have seen kids get much more sick, okay, than we had previously seen. And so kids are absolutely at risk for the Delta variant. And probably the question you're asking yourself is, how can I keep my child safe? Schools are going to be reopening. In fact, some have already begun to open. We'll talk about who's eligible to be vaccinated, but I'll just say at this point that it's kids over 12 now that are eligible for the vaccination. So a lot of our elementary school and preschool kids are not eligible to receive it. So the way you're going to keep them safe is, first and foremost, wear a mask. They need to wear a mask. And I recognize that can be difficult in young kids. I'm on the boards of 2 schools. So for those kids over 3 years of age, we have really required that they wear a mask, that they maintain, to the extent possible, social distance. In the school system, that's now been recommended to be at least 3 feet in the school environment, albeit out in the general community, we propose that you do or try to do 6 feet. And then, as Reverend Wortham pointed out, washing hands. Make it fun to wash your hands over and over again. And how long should you wash your hands? So one of the things to remember is a child should wash his hands and sing happy birthday. So that's about 20 seconds in order to wring their hands, do the soap. So sing happy birthday with them. That gets you to about that 20-second mark, which is adequate for trying to remove most of the germs that are present on a child's hands. Now I want to turn and talk a little bit about the vaccines. So there are 3 vaccines that have been approved by the FDA. They include the Pfizer vaccine, the Moderna vaccine, and the vaccine by Johnson & Johnson. Let me start with the Pfizer vaccine. So the Pfizer vaccine is a 2-vaccine regimen, typically separated by 3 weeks, okay? Now, it doesn't have to be exactly 3 weeks between, but ideally the window is somewhere between 18 and 25 days to get your second shot. So don't fret if you don't get it exactly on the 21st day, but it is important to get both of the doses ideally separated by 3 weeks. Now, what you also need to know is that your immunity from that vaccine really kicks in about 10 to 14 days after the second vaccine, okay? So, if you only get the first vaccine, the study suggests that it provides somewhere between 50 and 60% protection. When you get the second vaccine, after that 10 to 14 day period, you're talking about the effectiveness of the vaccine rising to somewhere between 90 95%. That does not mean that you cannot get the disease, okay? And we have seen breakthrough infections, especially with the Delta variant. But what we also know is among those who have gotten the virus, who have been appropriately vaccinated, their symptoms have been far less severe. And indeed, most have never required hospitalization nor progressed to the more serious complications associated with COVID-19. The Moderna vaccine is the other vaccine that requires 2 doses, but usually separated by 4 weeks. Again, very important to get both doses because like the Pfizer vaccine, if you only get 1 dose, then you're only getting about 50 to 60% protection versus, again, 90 to 95% protection if you get the second dose after 10 to 14 days from that second dose. All right. As far as Johnson & Johnson, it is the only approved vaccine that is a single dose of vaccine. Okay, so you only are required 1. It is highly effective in terms of preventing severe disease. Now, the studies suggest that effectiveness may be a little bit less than Pfizer or Moderna, but still a highly effective vaccination. All right, so I want to stress highly effective. And if you get the disease, what all 3 of these do is reduce the severity so that you do not progress to requiring hospitalization or, heaven forbid, ICU admission to the intensive care units. In terms of the side effects of the vaccine, and I got vaccinated shortly after they were available, so I have been vaccinated. What you typically will experience, because realize what the vaccine is doing is sort of priming your body. So when it is exposed to the virus, it says, oh, been there, done that, seen this before. I've got some antibodies here in the body that are going to fight off this infection and prevent severe disease. So you may feel a little bit of body aches after you get the vaccine in the first anywhere from 24 to 48 hours. Sometimes you may even have a mild fever. And I actually experienced that after the second dose. It is more common to experience that after the second dose than the first dose, but some people have experienced it after both doses. So those are typically the side effects that you are going to experience. Is the Pfizer vaccine safe for children? Yes, it is, but the indication is for children age 12 and older, okay? What about the impact of COVID-19 in minority communities? Why does it seem to disproportionately affect Black and brown folks? I think the reasons are multiple. First of all, candidly, in our communities, especially in the African American community, there's suspicion about vaccines. So we just need to own that, and there's legitimate reason for that suspicion. There were some awful things that were done. Some of you may be familiar with the Tuskegee experiment and others, where, frankly, Black men were untreated who had syphilis. And that study went on for 40 years and was endorsed by the federal government. So we need to own that created natural suspicion among our folks about getting vaccinated. There are suspicions about how quickly this came to market. Okay, it can't be safe because it usually takes a long time for these things to come to market. I want to assure you that the science that led to the development of these vaccines was 10 or more years in the making. And what we did, because so many people were falling victim to this disease, is we said, we're going to pull out all the stops, take out all the barriers. We're not going to require that you raise money for research and development. The federal government's going to fund this so that we can get to a point of offering this vaccine as soon as possible. I want to assure all of you that the science is sound behind these vaccines, that the work around development of these types of vaccines predated this pandemic because we knew something like this was on the horizon. So that's another reason why there has been suspicion among our Black and Brown communities about getting this. We have found that the disease typically can manifest in a more serious form for folks with pre-existing conditions. So those who are overweight or obese, those with diabetes, those whose immune systems are compromised, and disproportionately, some of those illnesses fall in the Black and Brown communities. So we have then endured much more severe consequences when we have gotten this disease than other races. So that's another contributing factor to why this has disproportionate. Yield the floor to my colleague, Dr. Mitchell-Chadwick, but I just want to end with a plea for you to ask your questions, be informed, but for you to consider, if you are unvaccinated, getting vaccinated. Remember, your children under 12 cannot get the vaccine now. What you can provide by getting vaccinated is reducing the chance that other variants are going to arise in the community that are far more aggressive than even the Delta variant. That you, by being vaccinated, provide protection for your children who can't take advantage of the vaccine, at least at this particular time. So you're not the exposure that could potentially cause them to develop the virus themselves. So I want to thank you all for listening. I look forward to your questions. Thank you for your time and the opportunity to speak. And I will yield the floor to Dr. Mitchell-Chadwick.
Thank you, Dr. Bryant. That was an excellent overview and presentation. Really appreciate that. I have some slides that we're going to review today. Okay, so everyone should be able to see those. So first, I just want to say that I'm so pleased, and I want to thank FAME, CTSI for putting this together. This is an amazing platform to be able to reach out to the community, share knowledge on this topic that is affecting so many people in our community. And it seems to be changing on a daily basis now with this new Delta variant. The questions that are included in this presentation are real life questions that our patients are asking in our clinic on a daily basis. So I hope this talk will be extremely helpful. COVID-19, pregnancy, infertility, breastfeeding, it seems to be a very hot topic. And I hope to dispel a lot of myths that are unfortunately circulating in the media. All right, so our first slide, we're going to talk about COVID-19 and pregnancy in general. So a common question that we get, can pregnant women, patients, get COVID-19? Absolutely yes, 100%. In fact, our current reports suggest that pregnant and recently pregnant women actually have a higher risk for even more severe illness from COVID when compared to non-pregnant patients. Now, why is that? It's extremely important to understand that pregnancy as a condition is an immunocompromised state, right? Which means that a pregnant patient does not have the same immune system as a non-pregnant person. So the ability to fight disease such as COVID is altered. Pregnant women who have had COVID-19 and show symptoms are definitely more likely than the general population to need ICU, to need a ventilator for breathing support, and to actually die from the illness. And this has been shown to be especially true for pregnant and recently pregnant women with certain conditions, as Dr. Bryant said, so obesity, diabetes, high blood pressure. I want to review a couple of stats that really stand out to me, and that has been proven in the literature. So pregnancy is independently associated with a 3-fold increased risk for ICU admission, a 2.4 increased risk for needing ECMO, or a machine to handle circulation for your body, and a 1.7 increased risk of death due to COVID-19 compared to the general population. And pregnant patients that had comorbidities such as BMI or obesity greater than 35, diabetes, heart disorders, those older than age 35 or advanced maternal age appear to have a particularly elevated risk for these maternal outcomes as well. Other conditions like cancer, chronic kidney disease, COPD, again, heart conditions, immunocompromised states from having an organ transplant, or sickle cell anemia, and smoking. And it's extremely important to know that Hispanic, Latinx, and Black patients are disproportionately affected by this severe maternal morbidity and mortality and have a extremely higher incidence of COVID-19 infection and death. So a next question comes into, can you give COVID-19 to your baby during pregnancy? So it is possible, but it's likely rare in utero. So researchers have found a few cases of COVID-19 that may have been passed to the baby during pregnancy through the placenta. But this does seem to be rare. So passing COVID to your unborn baby while pregnant, it's not a very common event that is happening to most pregnant patients. However, the key is to know after birth, the baby, the newborn, can definitely get the virus if they are exposed to, for example, during breastfeeding, if the mom has COVID and does not follow contact precautions carefully. All right, go to the next question. So what are some possible complications for pregnant moms if they get COVID-19 during pregnancy? So the high ones are preterm birth that we've seen, or delivering your baby before 37 weeks, and stillbirth. And we always know for a fact that high fevers in pregnancy, especially in the first trimester, can raise the risk of birth defects alone, despite COVID or not. Now, some studies have suggested, oh yeah, that's great, that's great. So what should you do if you have COVID-19 and you're in labor, right? So it's important to, number one, update your OBGYN about your status and delivery planning. So in most cases, the good news is that the timing, the method of delivery, whether that be vaginal delivery or C-section, usually does not need to be changed. So for example, women who are sick with COVID probably do not need a C-section simply because they have COVID. Now, our governing body, ACOG, does believe that the safest place for you to give birth is either at a hospital-based birth center, or an accredited freestanding birth center. And we, as USC, 100% agree with this. We believe that home births are not as safe as possible. And so even the healthiest pregnancies can have problems that you have no control over and have little or no warning during labor. And so hospital setting can give you and your baby the best care in a hurry that you need. And keep in mind also that hospitals, hospital birth centers, they follow really strict procedures to clean and control infection. And actually getting COVID from hospital is extremely rare, right? You're more likely to get COVID from public areas such as the grocery store or the gym. Now, it's important for you to touch base with the hospital or the birth center because they may be adjusting their policies. So it's important to be up to date on those changes, which can change weekly at this point. So for example, there may be changes to the number of visitors that are allowed in the room while you're laboring, and how long you'll stay in the hospital. It's really important to check with your hospital and your OBGYN regarding your birth plan and if that's still on track to happen. And it's also important to mention if you do have a doula that you plan to be with you during childbirth, to ensure that they can be present with you during labor and understand the screening requirements that will be needed for them to be in the room with you. Other things to consider now that we're in COVID and having deliveries in the hospital is that you should and will need to wear a mask during labor and delivery. Now, it's not realistic to wear a mask the entire time, especially if you're pushing, right? But for this reason, those members of your healthcare team around you will be wearing a mask and other protective breathing equipment so that you are not exposed while you do not have a mask during pushing. And some hospitals also will recommend that we test for COVID regardless of symptoms, because unfortunately there has been many asymptomatic carriers that have been admitted to labor and delivery. And then it's also important to discuss if you do have COVID, whether it would be advisable to have your baby stay with you in the room or be separated from you in the hospital nursery. Now, current reports are suggesting that the risk of a baby getting COVID-19 does not change whether the baby is in the room with you or in a separate room, especially if the crib is kept 6 feet away. Some hospitals have plastic cribs that are enclosed, keep an even temperature for babies. However, it's extremely important if you decide to breastfeed that you do practice strict precautions such as wearing a mask, washing your hands, wearing gloves, so that baby is not exposed to COVID. And for some patients, they feel more comfortable pumping and allowing someone else to feed baby with their breast milk until the COVID window has passed. And that is a personal decision that you can make with you and your doctor. All right, next slide. All right, so COVID vaccine and pregnancy and breastfeeding. Are vaccines safe for pregnant women? Yes. Should pregnant women get the COVID vaccine? Yes. Should breastfeeding patients get the COVID vaccine? Yes. Okay, I'm going to keep it extremely simple. All right, now we'll go into reasons why, right? So growing amount of data confirms that COVID-19 vaccines are extremely safe during pregnancy. Okay, we have compared the pregnancies of women who've received the COVID-19 vaccines versus women who have not. These two groups of women have had similar pregnancy outcomes. Data does not show any safety concerns. We're going to review the largest study that we have and outcomes so far on the next slide. But in general, our governing bodies, ACOG, SMFM, strongly recommending that all pregnant women be vaccinated against COVID-19, right? Now, this has actually changed recently. So at the beginning of COVID last year, recommendations were actually controversial due to there being a lack of evidence, right? It's important to understand that pregnant patients, breastfeeding women were not included in the original COVID trials. So it's very understandable why patients were very hesitant about getting a vaccine that we didn't have much information about. However, now with studies coming out, we've seen high benefits of COVID vaccine for these groups. We are formally recommending that all pregnant patients do get the COVID vaccine. And then breastfeeding. Also, it's important to understand that breastfeeding women also should get the COVID vaccine. There's also no need to stop breastfeeding if you want to get the vaccine. It's important to note that whether you're pregnant or whether you're breastfeeding, you have the potential to pass antibodies either from the breast or from the placenta to help protect your baby from getting the virus. And this is amazing when you think about it. Pregnancy, breastfeeding, those are the only unique conditions where, one human can pass antibodies on to the other. And so getting the vaccine, thinking about it, is not only protecting yourself, but protecting your baby in a very huge way. Studies have shown that antibodies are being passed through the placenta, are being passed through breast milk. And now we're starting to recommend that you get the COVID vaccine as early in pregnancy as possible, because studies have shown the earlier you get it in pregnancy, the more time, the more antibodies that are actually being passed on and converting to baby. Next slide. Right, so this is the largest study to date evaluating the safety of the COVID-19 vaccine, particularly in pregnant patients. So the study has looked at over 35,000 participants who have identified as being pregnant in the V-Safe surveillance system. And that's further has been broken down to about 3,900 participants who decided to enroll in the V-Safe pregnancy specific registry. Now, so far out of these 3,900 patients, 827 pregnancies have been completed thus far. And there's two important findings that are emerging. Number one, vaccine reactions are similar between pregnant and non-pregnant patients. So pregnant patients are not responding any differently to the vaccine, right? Secondly, the rates of miscarriages, stillbirth, preterm birth, smaller sized babies, or unfortunately fetal death are all within the normal expected ranges when you compare it to baseline rates in patients who have not received the COVID vaccine. So this means that pregnant patients are not experiencing any different rates of these bad complications happening solely from receiving the COVID vaccine. So your homework for tonight is going to be Google this study, and I want you to read it, and I want you to analyze it so that you know the latest research that is available on the COVID vaccine. Next slide, please. Finally, we'll discuss COVID and GYN health in general, right? So there's some important facts to understand. Number one, the vaccine is not a live vaccine. It's not gonna cause you to get the COVID virus. It's simply gonna help your body recognize it and create antibodies to fight it when you are exposed. It's also important to understand that the vaccines are not affecting your genes or your DNA. So this comes to break a huge myth that unfortunately is circulating in media news that the COVID vaccine is causing infertility. There's absolutely no evidence that the COVID-19 vaccine is causing infertility or has the capability through its mechanism of action that it could cause infertility for both men and women. So we are recommending vaccination for anyone who is considering getting pregnant in the future. If you find out you're pregnant after you've had the first dose of, say, the COVID and Moderna, we still recommend that you get the second dose on time. And then another topic that has come up is change in periods, right? And so studies are still limited in this area because a lot of the studies have been focused on pregnancy and infertility. However, many of my patients personally have experienced some changes to their period after receiving the COVID vaccine. So for example, up to 2 to 3 months, some patients have experienced either slightly heavier periods or a couple of days difference in when their periods start. This is not harmful, and it actually resolves at a max of 3 months later. I will reassure, getting COVID and being sick in the ICU will have even more dramatic effects on your period, trust me. And then relating to breast imaging, so for screening mammograms, typically after age 40, we do recommend yearly mammograms for even patients without symptoms. Your mammogram should be scheduled before your first dose of a COVID-19 vaccine, sorry, or 4 to 6 weeks after the second dose. That way there's time for your nodes to return to their normal size. All right, next slide. All right, and so the question is, where are we, right? So unfortunately, despite the growing evidence of the benefits, the very small risk associated with the COVID vaccine, our patient populations are still not at ideal rates. So only about 16% of pregnant people have actually received 1 or more doses of the COVID vaccine. And a recent CDC report in June has found that vaccine during pregnancy was actually lowest among the Hispanic and non-Hispanic Black women and younger women aged 18 to 24, actually highest among non-Hispanic Asian women and women ages 35 to 49, right? And so on that note, it's also important to understand that COVID is hitting the Black and Latinx patient population on an entirely different level, especially our pregnant patients. So not because of biology, but it's important to understand that Black, Hispanic women are more likely to face social, health, economic inequities, implicit biases, differences in treatment from providers that put them at greater risk of this illness. So personally, in my clinical practice, I found that my pregnant patients that are getting COVID are tending to be my Latinx patients, especially those with underlying conditions such as diabetes. Those are the ones that are unfortunately requiring hospitalization, admission to the ICU. So the disparity numbers that we see in the news are extremely, extremely real. So I hope this information was helpful. I apologize, I was coughing. I do not have COVID. Thank you so much for your time, and I look forward to your questions.
Thank you, Dr. Mitchell-Chadwick. Christian is going to pull something up really quick. We displayed this at the beginning of our talk, but we just want to draw everyone's attention to some upcoming events for the Vaccinate LA and what we have planned throughout the month of August. So we have a vaccination clinic and food donation opportunity at the Fame Church. We have Ask a Doctor in Spanish for back to school virtual town hall, and then the same event in English. We also have a vaccination clinic that we're doing in partnership with the National Council of Negro Women. That's on August 14th. And then another vaccination clinic at Fame to close out the month on August 29th. I see Reverend Judy's clapping. Yes, we're very excited about that. Thank you to all of our panelists. I think now we're going to turn over for some questions. I have the questions, Mr. Lawson, so I'm going to just ask them, and there will be questions for everyone here, all of our panelists. So I'm going to just go ahead and dive right in. Okay. So let me start with a question for Reverend Judy. How can we help the faith community get vaccinated? Oh, you're on mute, Reverend Judy.
Thank you. I think that all that we're doing is a perfect example of how we can get everybody vaccinated. This town hall is so super important. And I thank you to the doctors and to everybody involved, all the panelists, but especially as you said, Mr. Lawson, I'm not an expert in the medical field either, but I do lean towards them. And so as we continue to partner more and more, understanding that together everyone is better, that's how we can help the faith community get tested. And we know that I can speak as an African-American, as African-Americans, to be able to go to your church or to a church, that's a trusted place for anybody, whether you go to church or you don't go to church. And so it's so important that we're able to continue these partnerships.
Thank you. My next question is for Mr. Lawson. The question is, what can African-American leaders do to encourage their community to get vaccinated? How do we use our voices?
Thank you very much for that question. We have to be very forthright in our discussions. We have to make sure that our community knows that we, as community leaders, rely on the medical community. We rely on the people who are on this Zoom call. We listen to the experts in terms of what we should and should not be doing, and not be confused by social media that these statements and I'll just say outright lies are not coming from people who have your best interests at heart. As Dr. Bryant mentioned, yes, there were horrific things that happened through the medical community in years past. But that was, at that time, we didn't have people that looked like us in the process. So we're looking at people that we can trust. We're listening to people that have our best interest at heart. And I can't say it enough times that we need to pay attention to what's going on. And so you go to Fame, you go to a facility where the Los Angeles Urban League is there. You go to King Drew, but understand that our people have been in the forefront of designing and shepherding these vaccinations through, so we can trust these people who have spent their lives to focus on our health. There was one other thing that my criticism of the medical community is simply this. sometimes your language is such that we don't quite understand what you say. When you say this is 80% effective, and people say, well, I'm going to wait for it to be 100% effective, I have to remind people that percentages mean different things in different capacities. LeBron James hits 83% of his free throws, but we're not waiting for somebody who hits 100% of their free throws before we hire him. This is, we need to explain to our brothers and sisters that the percentages that you're talking about are the best that they'll ever see. And that's why we should encourage everyone to get vaccinated.
Thank you, Mr. Lawson. That was very well said. Thank you. Let's see. I have a question for Dr. Bryant. Some young people in their 20s state that they're too busy to get vaccinated. What can we say that will convince them to take COVID-19 threats seriously?
Sorry, I was muted. So thank you, Doctor. Thank you, Mr. Lawson, for calling me on the carpet, and I want to acknowledge that yes, this is as good as vaccines get. So I want to say that unequivocally. There is nothing that is 100% effective, and that we have vaccines that get close to offering you the greatest protection that any vaccine can is compelling. But to your question about 20-year-olds, so let me share a personal story. I have lost 10 relatives to this virus, 10. I'm from Louisiana, and down in Louisiana, we have a large extended family, and many of them live in the old homestead. And sadly, my family was under the mistaken impression that, you know what, they spent their social time with one another, but they worked outside of the community, and they got exposed to other things in their work environment and in their daily lives outside of their homes that sadly they brought back into that community, and people perished. So this virus doesn't respect age. It doesn't respect money. It doesn't respect position. It doesn't respect education. It is no respecter of person. So if you are 20 years old thinking that you've got all your life ahead of you, that you are not going to be affected, 3 of those 10 members of my family who died were less than 30. So I beg you to remember that when you're thinking about your mortality and whether or not, no, it could never affect me. And the other sobering thought that I will leave with you is you never want to attend a virtual funeral. It is the most insulting way to say goodbye to someone that you love. To see them on a camera like this, to be restricted from saying your final goodbye because of the circumstances of this pandemic. Please don't be the one that thinks it can't affect you. It can.
Thank you, Dr. Bryant. That's heartbreaking. It's heartbreaking. Ooh, I just took the words right out of me. Yeah. Okay. I'm gonna ask another question that was asked by someone in the audience, and that question is gonna go to Dr. Mitchell. Is there a preference out of the 3 vaccines that you would recommend for women?
Yeah, that's a good question. There is no preference. We're all aware of the Johnson & Johnson vaccine trials that have occurred with potential incidences of clots that occurred specifically in women under age 50. To put those numbers in perspective, this happened in 3 to 4 women out of 4 million people. Think about that. That's tiny compared to 4 million people, right? And vaccines can have these side effects in anyone, right? So I wouldn't say that I recommend any vaccine over the other. All 3 have been proven to be safe. And you also have to keep in mind Johnson & Johnson is 1 dose. So if that's improving compliance among patients, then that's a benefit of that vaccine.
Right. Thank you. Okay, so there are a lot of questions. We touched on this briefly in the beginning about lately in the media, speaking of the media, we see a lot about breakthrough infections, and especially with this new variant. So I wanted to ask maybe to Dr. Bryant and Dr. Mitchell, do we have any stats on how many people have contracted COVID that are vaccinated? Are you seeing this in amongst your own patients? What does this really look like? Because we do hear, for the layperson, we're seeing this a lot represented in TV and news and so forth. But is this happening a lot? And if so, how often is it happening? And how's the recovery looking like for these individuals that were vaccinated but have breakthrough infection?
So I'm happy to start. The answer is yes, we are seeing breakthrough infections. So breakthrough infections are infections that are occurring in people who have been appropriately vaccinated, no matter what vaccine that you received. The numbers vary. We see that occurs more in environments where you have fewer of the population vaccinated in general, okay? Where you have, so you look at places, and again, I'll talk about Louisiana or Louisiana, which is a hot, all my relatives say it's Louisiana, not Louisiana. But it's a hotbed right now. The vaccination rate there is relatively low. So we are seeing greater breakthrough infections in those environments. So it varies depending upon where you are looking. What we do know around those who have had breakthrough infections, and I alluded to earlier, is that their disease, in many cases, have been asymptomatic. So some of this is caught just with routine screening. For instance, we do, in many of the schools, they're going to be doing routine screening. So these aren't people necessarily who have symptoms, but ultimately are found to be COVID-19 positive. But we know that those who do have symptoms have been far less severe in those who have been vaccinated, meaning they have not, by and large, required hospitalization or sadly progressed to death. So those are my thoughts.
Yeah, and I 100% agree. We are still having pregnant patients, despite getting the COVID vaccine, both doses, have COVID during pregnancy. Their disease is extremely mild. They didn't even know that they had COVID, maybe a sore throat or, a cough here and there. So it's a very dramatic, different type of COVID if you've had the vaccine already. But yes, it is possible, and we are seeing numbers that you can still get COVID despite vaccine.
Thank you both. A follow-up question from Tony in the chat. Question for Dr. Bryant and Chadwick: is the Pfizer vaccine safer for adults in general because it's the only one approved for children? And he says, I apologize if this question is dumb. I'm just very concerned for my wife and myself having to take the vaccine because our jobs are requiring it.
So no dumb questions at all. Again, the reason why Pfizer was approved for children 12 and over is because they had done trials over a sufficient period of time to demonstrate to the FDA its safety. Johnson & Johnson and Moderna, while they have ongoing trials, have not reached that same threshold. so that they could get FDA approval. So it's a timing issue as opposed to an effectiveness issue.
Great, thank you. Okay, I have a question from the audience. This person says, I am white but have Black family members who are choosing not to be vaccinated for various reasons, but it can't be ignored that their rights and needs have not been met by the scientific and medical establishments in the past. How can I engage in conversations with these family members, recognizing my significant privilege in so easily trusting medicine and science?
Well, first, it's nice that you recognize your privilege. A lot of people do not do that. White people have privilege in America. Physicians have privilege in America. And unfortunately, there has been terrible, terrible experiments and clinical trials that have been done on African Americans here in America recently. Tuskegee trials happened 40 years ago, right? So it's a very valid question. I think number one, it's important just to be honest, right? To say, I'm a white person, I have privilege, I do not face the same experiences in America, I do not have the same history as you do. So I am coming from that place. And I will say, coming to someone in that manner really allows one person to really take the walls down. Just because you get it, you're trying to get it, right? It's also important to come as not in a savior complex, right? Like, I am here to save you. No, I'm here to talk with you about this issue and help you, and we talk about it together as friends, right? The second key is to understand what their concerns are with the vaccine. A lot of people are just simply scared, right? Because they haven't had this platform. They don't have this information. They don't know about the studies that are out, and they don't know what these studies mean. And so it's important to really dive deep into what are actually your thoughts, your feelings, your concerns about getting the vaccine. And how can we connect you with a person, a reliable person that can address those concerns, right? And again, that's why it's extremely important that you have physicians that look like you, talk like you, come from the same experience and background as you, because I identify, my dad is African American, my mom is Mexican. I have many family members who refuse to get the COVID vaccine, even despite me telling them you need to get the COVID vaccine, right? But eventually we continue to talk about it and we go over the studies, and some people just need time, and that's okay. But they also need people that they feel they can trust. And that is why it's so important that physicians such as me and Dr. Bryant are here to let you know that, you know, we're not just saying these things because we're medicine. We have lived both worlds. We are living both worlds. And we totally understand your concerns. It's valid. And we hear you. We also have your best interest at heart, and want to be here to give you that comfort and support.
I absolutely agree with Dr. Mitchell-Chadwick, but there are two other resources or on this call who are panelists, and that's Reverend Wortham and Mr. Lawson. Because realize you may never have the credibility you seek to convince your African American family members to get the vaccine, which is why having a forum like this and a trusted resource, you know, in addition to taking the vaccines to churches, the other place that's been effective, barbershops and beauty shops, because that's where Black culture, I'm just speaking as a Black person, and yes, I go and get my hair cut despite the appearance of being bald, but I do go to the barber. But you gotta meet people where they are. And that's why setting up vaccination clinics in the churches, in the barbershops, in the beauty shops have been so highly effective, because that's where people let their guard down. They talk about politics, sports. That's where they have very authentic conversations and are willing to engage in venues where they might not otherwise. So, you know, having trusted resources who don't have any credentials behind their names, but who simply have a relationship with that person that is credible is so essential.
I'd like to weigh in on that. I thank you, Dr. Bryant and Dr. Mitchell-Chadwick. I think that one of the things that you said that is so poignant, and that's why I think talking about the trusted resources, and we like to look at ourselves in the Black churches, especially that's who I am, as the trusted messenger. You know, back in the civil rights days, I was a little girl, but truly whatever happened in the Black community was communicated through the Black churches, whether you were a part of the Black church or not. That's where the message was disseminated with trust and faith that everything was going to be all right if we would just unite and have one voice. And I think now, because we talk about Tuskegee so much, but one of the things I want to say, and I may get in trouble, and you guys might not ever invite me to speak ever again anywhere, but I'm going to go there, in that one of the things that I said to people, especially when we first started getting the vaccines and getting them the resources, I said, I forgot what they called them, but I want to call them poachers. The white people were running to the farm, running to the African-American neighborhoods to, you know, quote unquote, steal the vaccines that were labeled and supposed to be distributed for us. So I said, anytime the white people are running to get a vaccine, we need to understand that there should be no issues about, and I'm sorry, y'all might not ever invite me to speak ever again in life. But the bottom line is we have to understand this is what we have. This is what we have. And once folk got vaccinated, as you said, Dr. Bryant, earlier, our numbers were way down. Now, as you said, 90% of the folk that are hospitalized now with the Delta variant are not vaccinated. It's a no-brainer. It's a no-brainer. And I happen to be privileged and honored to be the young adult pastor at Fame Church. My favorite day of the week is Wednesday evening, because that's when we meet for Bible study. And some of them are not vaccinated. And I said to them just a couple of weeks ago, well, it hasn't hit me yet, Reverend Judy. So why do you think I should? What are you waiting for, Russian roulette? You waiting for your number to come up? What are you doing? But I am going to, Dr. Bryant, if it's okay with you, I'm going to share your testimony. As you said, Nikki, I was so moved when you talked about you've lost 10 members to this horrible disease. And I've officiated over some homegoing services in this form. It's horrible. It is horrible. You can't touch each other. We like to eat as Black folk. We can't eat together. We can't hug on each other. We can't say, baby, it's all right, and wipe your tears away. We can't do all that. This is a horrible thing. But Zoom is the best thing we got right now. And so we've opened up again, and what's happening? Super spreaders, because we're not vaccinated. You got me started, Dr. Bryant. You got me started.
Keep going. Keep going.
Please understand, we have got to get vaccinated. And the other piece I gotta say, just because you're vaccinated, I do this education at least 10 times a day. You gotta get tested. I get tested every week. Not only because it's at my church, but because I'm out and about. I am the Southern California director for the African American Church Initiative doing COVID testing. And so I'm out visiting my churches. I like to go to farmers markets and pick up my produce. I like to go for a walk on the beach. And so because I'm out and about, yes, I'm masked. I wash my hands so much, my hands look like an old woman's hands right now, but I ain't mad because I carry lotion and oil wherever I go. But the bottom line is I know I'm out and about. So I got to get tested, because I know that even though I've been vaccinated, and I was blessed. My mom is 95 and she's on hospice. And so she's in a skilled nursing facility. They called me because I've jacked them about her care many times. So they called me, they had extra doses. Remember in the beginning when some skilled nursing, had extra, they called me and said, you want to go? Yes, can I come right now? And so We have got to get vaccinated and then tested over and over and over again. And I'm going to ask the two medical doctors to correct me if I'm wrong. And I say, don't wait until you have symptoms. Get tested because you know you've been out and about, period. I went to one of my young adults graduated from Loyola on this past Saturday, and it was at the Sophie Stadium. I didn't even think about going. I went. Guess where I was Monday morning? I was at the church before they even opened for testing. I said, I need a test now. At 9 o'clock, I asked for a test, and I'm gonna get tested again, actually today, because I wanna make sure that I'm constantly on top of my status. So you don't have to be as anal as I am, but be aware that you're out and about, unless you truly are, sheltered in place. I think that most people are not sheltered in place anymore because of what happened on June the 15th. And so the bottom line is get vaccinated, get tested, and please talk to your family, talk to your friends, and help them understand that we don't have any other plan of action. This is the plan of action. And I don't care which, and I'm glad somebody asked which one is the best one. The deal is, like Dr. Mitchell-Chadwick said, get vaccinated and then get tested. And if you don't know where to get tested, call me. Call anybody, any of these panelists. We will help you. Thank you. I didn't mean to go on and on. I'm sorry, y'all, but I just got going.
No, I think what you're saying is so important. I think Dr. Mitchell-Chadwick wanted to say something. I didn't want to.
Oh, I said amen. Yeah.
Oh, yeah, definitely. I think being safe is super important, and just being considerate of the people around you. That's what, what we all need to do. Okay, so we have about 10 minutes left. I want to go through maybe one or two more questions while we still have some time. There was a question in our chat that said, are there any breakthrough infections of fully vaccinated people who are immunocompromised?
So that would fall under the category being immunocompromised, what they call protected healthcare information. So I assume, yes, that is true. I don't know what those numbers are because you have to be careful not to identify folks. But yes, I would not be surprised that is true. I can't cite you a statistic then.
Okay, thank you, Dr. Bryant. I had another question. It was kind of specific to a medical condition, but a person asked, is it possible to get vaccinated with any of the available vaccines if a person suffered previously from Guillain-Barré syndrome?
So they're talking about Guillain-Barré. I would invite them, I would highly suggest they talk to their primary care doctor first, but do that to find out if they are any, what they call, please consult your primary care physician if you've got a pre-existing condition that may compromise your immune system. But in general, it has been recommended that you get the vaccine for those with acquired immunodeficiencies here in the United States. So in general, but please talk to your primary care doctor first.
Thank you. So we're hearing a lot still, we heard a lot in the early days of the pandemic about herd immunity, this concept of herd immunity. Someone asked, what number are we trying to get to in order for herd immunity to be effective?
100%.
100%.
100%.
Polio was wiped out. Why? Because everyone got the vaccine. We're trying to do the same thing with COVID.
Thank you. Okay, I think I've actually gone through the majority of our questions. I want to see if there are any more questions. Folks can put that in the Q&A box or in the chat for us. Maybe give folks just a minute more. For our panelists, is there anything else that you'd like to add or leave people with as we wrap up this event?
I just want to reiterate, pregnant patients need to get vaccinated today, tomorrow. for themselves and their baby. Breastfeeding patients need to get vaccinated. There's no effect on fertility, and there's no cause of autism in these vaccines. These are all myths, and I pray that this point is extremely clear. All pregnant patients need to get vaccinated.
I think I'll end with, and yes, Reverend Wortham, you're welcome to use the personal story that I shared. This disease does not respect person, education, pocketbook, age. It does not respect any of those things. It is an equal opportunity infection. And for Black and brown folks, because we have other issues in our healthcare status, it can be devastating. And don't let your youth fool you. I beg you to keep that image of a virtual funeral. You never, ever want to go to a virtual funeral. It's awful.
Thank you, Dr. Bryant. I don't think anyone will forget that image. So thank you for sharing that, even though it's very heartbreaking and painful. If you stayed this long, thank you so much. We want to tell you how you can get that vaccine. So Reverend Judy, please, can you give us some information about where people can actually go to get that vaccine? Tell your friends, tell your neighbors, tell your family.
Yes, absolutely. On this coming Sunday, August the 8th, from 9 a.m. to 12 noon, please come on down to my house, 2270 South Harvard Boulevard, Los Angeles, 90018. We will be there from 9 to noon. And for the first 100 families, we will have food basket. We want you to come, bring your friends. And like I said earlier, if you've been vaccinated, bring your friends who have not been vaccinated. Get tested if you've already been vaccinated. And tell your friends and family who are refusing that we want vaccines because all lives matter. That's my new saying. All lives matter. And the only way we can get in touch with this is by doing that. And so on the screen, you see 3 weeks from this Sunday will be the second dose or your first dose on August 29th back at my house, the Fame Church, Los Angeles. And then we have on August the 14th, partnership with the NCNW, National Council of Negro Women, vaccination clinic from 1 p.m. to 4 p.m. The address is listed there. And then every Tuesday for the month of August, you can come to my house from 10 a.m. to 1 p.m. and get vaccinated. We'll have all 3 vaccines there. On Sunday, we'll have Pfizer and J&J. I think that's the same for the National Council of Negro Women, correct? Pfizer and J&J vaccines. But if you need to get in touch with any of us, please do. I can tell you on a daily basis where to get vaccinated. We want it done. We want those shots in the arms now. Thank you.
Thank you so much, Reverend Judy. With that, I will say again, thank you so much to Mr. Lawson, Dr. Mitchell-Chadwick, Dr. Bryant, Reverend Judy, my colleagues, Christian, Natalia, Laura, everyone who has helped us make this possible. And we hope to see you at one of these events. And if you have any questions, we're going to put some contact info in the chat. Please reach out to us about testing, vaccine, anything, any question you may have. We will help navigate you to the right spot. And I hope everyone has a great rest of their evening. Thank you so much.
Thank you. This is wonderful.
This was great. Thank you, guys.
Thank you. See you later.
Thank you all.